Hi there, and welcome. My name is Dr. Paulson, and I'm the Medical Director of Antidote Medical Partners. Our clinic provides an effective treatment for depression and anxiety called TMS, and you may be watching this video as you're wanting to know more about what TMS is. TMS stands for Transcranial Magnetic Stimulation. Transcranial magnetic stimulation is an FDA-approved treatment for depression, anxiety, PTSD, and OCD. Research has also discovered that TMS is beneficial for individuals with substance abuse disorders, as well as some of the symptoms of pervasive development disorders, for example Asperger's or autism. To understand what TMS is, we need to first understand how our brain works. Our brains help manage our thoughts and create pathways that communicate with each other, via both electrical and chemical messengers. Each type of thought or feeling corresponds with certain pathways that these signals travel along, and the more times our brain practices particular pathways, the better the brain gets at doing whatever we practice. Let's see how this relates to depression. Here you can see a PET scan of a typical brain. In a typical brain, these researchers light up and the oxygen and glucose act as fuel, which allows us to see which areas of the brain are working. Next, we have an equivalent scan of someone who has depression. You can see when you compare the two brains that the typical brain has more activity in certain regions like the frontal lobe. But even more importantly, the central areas of the brain where the limbic system is. The limbic system is the emotional center of our brain. And in individuals who have depression, the limbic system is way out of practice. You can see this by the area being darker as it's not being fueled by glucose or oxygen. Now we need to explain how the treatment actually works. During the treatment for TMS, a magnetic coil is placed over the head, which uses an electromagnetic field which provides for enough energy to cause the neurons right at the surface of the brain to reach an action potential. This basically means that the neurons turn on, and these neurons cause other neurons to fire, and so forth and so forth. This domino effect of neurons reaches deep areas of our brain, specifically reaching the important limbic system. It effectively works out these pathways that are associated with being happier, less anxious, and generally more relaxed and content. As you can imagine, a single positive thought can practice a pathway once. However, during a TMS session, practices these positive pathways 3,000 to 5,000 times. That means that during a course of around 30 sessions, the positive pathways are stimulated approximately 100 to 150,000 times. Do you know what that means? Just imagine if you practice a particular skill, sport, or hobby 100 to 150,000 times. It's fair to say that you'd be pretty good at it after practicing it so many times. After all, they do say practice makes perfect. The more your brain practices these positive pathways, the more of an expert your brain becomes at experiencing the feeling of joy, happiness, and contentedness. At the same time, your brain becomes not such an expert at feeling depressed, anxious, or sad. The best thing about TMS is that it's a non-invasive, outpatient procedure. There's no anesthesia and there's no need to stay in the hospital. Patients are also free to listen to music, watch movies, chat to each other, and generally relax. Patients are also able to drive themselves for the treatment, and when the procedure is complete, patients are able to drive themselves to work, school, or wherever they're meant to be that day. I guess you may be wondering about what side effects there might be with TMS. Another great thing about TMS is that because TMS is non-systemic focal treatment, that means it has none of the traditional side effects that patients may experience from psychiatric medication. Traditional psychiatric medications are well known to cause a lot of potential side effects, which can include weight gain, sexual dysfunction, low libido, memory difficulties, nausea, stomach ache, sedation and tiredness, blurry vision, dry mouth, and more. The most common side effect of TMS is a mild headache during the initial sessions, which disappears over the course of a few days. However, the vast majority of patients report no side effects whatsoever. Because of all the benefits of TMS, it means that this is a fantastic option for anyone who may not have benefited enough from traditional antidepressant medications, or for someone who experienced many of the side effects when using antidepressants. It's also an excellent choice for anyone interested in trying treatment without the use of medications. And while TMS is effective for those with major depression, it's also suitable for less severe symptoms, and generally for people who just want to feel happier and more content. To learn more about TMS or to book an appointment, simply visit us at antidotetulsa.com. You can also give us a call, 918-558-3088. Thank you for watching.